why do we need this hormone? Are there things that we need to know? Do we need to monitor it? And what are the functions of this hormone? And one or two things about if it's overproducing or if it's not producing very well. What happens to our body? And here with me again is Dr. Hope.
Hello. So thank you. Yes, welcome. We're doing a new topic about hormones. We've spoken about hormones before, but individually. But today we just wanted to go over the entire topic of just hormones, the general topic of hormones, what they are. And we're going to start out with a definition, right? What are
Yes.
hormones, right?
Yeah.
Hormones are chemical messengers in our body that goes to different organs and different organ systems throughout the body. So hormones can affect the heart, it can affect the lungs, it can affect your kidneys, even the brain function, your muscle. It really can affect all areas, pretty much all the areas of your body. So it's the effect of these different chemicals on that particular organ system that manifests with a certain type of reaction that can lead to diseases. So either the overproduction of that hormone or the underproduction of a hormone can cause a medical disorder. So we wanted to start out with some examples, right, of hormones.
Yes. And I wanted to just chip in a little thing that, listen, you might be wondering, why do I need to know about my hormones? Do I care about my hormones? Oh, yes, you should care about your hormones because there are many problems that could happen or things you could have fixed or control if you are aware about your hormones. And that's why we are talking about it today. So just stay with us and we'll give you one or two tips, and yes, I'm pretty sure that you will love it.
All right. So let's go through some examples of what hormones are. So I'm going to start out with the most common hormone that people don't even think of it as a hormone. It's one of the most common endocrine disorders, which is diabetes, right? It's the most common endocrine disorder. And the hormone responsible for diabetes is insulin or the lack of insulin. So either there's too little insulin, which can cause type 1 diabetes, or the insulin that is present is not working effectively. And you may have high levels of ineffective insulin, which is called insulin resistance. So that first one is the insulin hormone that is responsible for diabetes. Then there's the thyroid hormone. You can have too little thyroid hormone that can speed up your metabolism, or too much thyroid hormone that can speed up your metabolism, or too little thyroid hormone that can slow down your metabolism. And then there's growth hormone. Again, too much can lead to gigantism. Too little can lead to dwarfism. And then the reproductive hormone. So some of the reproductive endocrine disorders are like polycystic ovarian syndrome in women, where they may produce more of the male hormone than the female hormone, that can lead to irregular menstrual periods and difficulty with fertility. Other hormones, cortisol, the cortisol hormone. So cortisol is overall responsible for the general metabolism and functioning of the body. So if you have too much cortisol, it can lead to weight gain and even diabetes, brittle bones. It can lead to a lot of metabolic problems. Too little cortisol can lead to low blood pressure and weakness and fatigue, and an inability for your body to even handle severe illness by maintaining a normal blood pressure. So these hormones, they're not talked about too much in the general public, but sometimes these hormones really can have significant effects on the body. So it's important to know. Grace, so what do we have to monitor these hormones? Do we have to check these hormones ourselves?
So we don't have to monitor these hormones, but because the hormones we usually talk when they are overproductive or when they are deficient, they will give you symptoms and signs that we either take you to your primary care physician to ask what is going on with you, or they will just in your blood in their when they do the blood work, they will see that you have abnormal level of hormone. So you don't generally have to monitor it. I know for sure some emergency room they do check some of your thyroid hormones as part of their routine workup when you come to the emergency room. But I would say yes to monitor it if you have been diagnosed of any of these problems. But do not you don't have to monitor insulin when they have told you you have insulin deficiency or you have overproduction. That is totally different ball game on how to manage it, because we don't monitor the insulin. Instead, we monitor the blood sugar that the insulin is causing, or the deficiency of it is causing the problem. So yes and no, you monitor it if you have been diagnosed of problem like thyroid hormone problem, like infertility, and like if you have growth hormone problem, or your prolactin level is not growing, is not enough, or it's too much,
That's right.
then we monitor it. But
Okay.
if you don't have any symptoms, no complaint, ideally you don't have to monitor. But it's just good for you to know that these hormones are working.
Right. So you're saying basically you only need to monitor the hormones or the symptoms of the hormones or the effect of the hormones only if you have either an overproduction or a deficiency of these
Correct.
hormones. So that's important to know. Thank you for sharing that with us,
Yeah.
Dr. Grace.
Yeah, so and I think this is just a small topic we're talking about today. So we our take home point, right, guys, is just going to be
Mhm.
that we should have idea or be knowledgeable. Remember, one of our themes: the more you know, the better you are. That if you are aware that you have chemical messengers in your body that
Mhm.
can affect your mood and that can help you grow and it can help you very productive, and these hormones are very important. And when you have symptoms or signs that relate to its deficiency or its overproduction, then it's necessary for it to be checked out and for you to be treated. And that is we endocrinology is our area of specialty.
That's right. So thank you again for that. So hormones are messengers. They're chemical messengers in the body that are responsible for bodily functions. That's right. And as Dr. Gray said, only if you have a deficiency or excess do they need to be monitored, or the manifestations of them need to be monitored. So be very vigilant about your general care, right? So if you won't know that you have any manifestations of these if you don't see your doctor. So
Mhm.
we encourage everyone to get your physicals every year so that maybe you can pick up on these hormones, because you may have symptoms that you're not even aware are related to an effect of these hormones. And only if you get general evaluation, your physical exam annually, at least annually, only then will you know that there may be an abnormality, unless it just presents itself in a severe form that causes you to go to your doctor or the emergency room. All
Yeah,
right. Thank you
yeah.
so much.
So please, next week, on the 22nd of February by 5 p.m. Eastern Time, we're going to be live again to talk
Yes.
to us. Yeah. And if you have any question with regards to your hormones, we want you to write it down and get it ready to ask us the questions. We are here to help. And remember, the more you know,
The
the
better
better
you
you are.
are. Thank